general, there are two diseases that many of us as adults will suffer from. The first is gum disease, which is entirely preventable. It's important to thoroughly clean your teeth, but not just with a toothbrush, but also to clean between the teeth. Classically, that's floss, but wiping a tooth with a piece of string isn't always that effective, so we'd recommend little brushes between your back teeth. The other disease is dental decay, and again, largely preventable. I think we all know it's caused by sugar, but what we don't maybe appreciate is that it's really the frequency of the sugar intake that can be an issue. Other diseases that we check for are tooth erosion and general tooth surface loss from tooth to tooth contact, which we call attrition. And as long as we have all of those stable, we can ensure we have a nice, healthy mouth to make the long-lasting restorations that we're considering. I'm a general dentist, and I will refer to specialist orthodontists for what we call comprehensive orthodontics, but that's generally going to take 18 months to 2 years. What we now have are some options to mainly straighten the front teeth, and that can happen as little as 5 or 6 months. The first option are aligners, clear removable trays that each one moves your tooth a little bit. The positive is that they're removable, but the downside is they're removable because you need to wear them 22 hours a day and therefore be quite disciplined. The alternative is we can fix braces to your teeth, and those can be tooth coloured on the outside or even on the inside of your teeth. And we can straighten most adults' teeth in as little as 5 to 6 months. Once they're straightened, we can look at correcting any wear and correcting the colour with many different treatment options. Tooth whitening, as long as it's carried out by a dental care professional, is completely safe. We would recommend home whitening, where moulds are taken of your teeth and a very close-fitting tray is made in which you put hydrogen peroxide gel. The trays are worn either overnight or for 2 to 3 hours in the evening. Whilst you're whitening, you may expect your teeth to be a little bit more sensitive, but at the end of the whitening process, they'll be no more sensitive than they were before. Whitening, as long as it's maintained with a day of whitening every other month, will maintain the colour of your teeth, so much so that we're happy to match porcelain or plastic filling restorations to the whitened shade. Power whitening is available, but you would still need to wear trays for about the same amount of time as if you weren't power whitening. And so, with the concentrations that we're allowed to use, we would generally recommend home whitening as being the best option. A porcelain veneer is a facing of porcelain that's bonded onto the front of your teeth. We can sometimes correct worn teeth with just edge bonding, and we can do composite veneers, but porcelain's probably going to last longer than any of those. A porcelain veneer is added onto the front of the tooth, and if we're doing a single tooth, we'd have to make space for that veneer, generally about 0.5 millimeter. However, the more we can add to the front of the tooth, the less we have to drill. So if we can add 0.2 or 0.3, we only have to remove 0.2 or 0.3 of a millimeter. If we can add the whole 0.5 millimeter without making the teeth too bulky, then we're in the realms of a prepless veneer. A veneer works best when it's bonded to enamel, and so it's very important that we think additively and don't just drill teeth away. Done correctly, porcelain veneers should have a life expectancy of 10 to 15 years or possibly more. I think it's important to realise however well we do anything, it will have a lifespan, and so being conservative is the most important. We have a few options to show you what veneers can look like. And the first is we take photos and we can do a digital imaging of that photo to give a simulation. The problem is that's not showing you in your mouth. And so the best way is if we can put plastic material onto your teeth. So I would take moulds of your teeth and ask the lab to wax up the teeth onto that model, a 3D preview of the shape of the veneers. If I have a mould of that and I fill that with plastic material, I can put that on your teeth without touching your teeth. We call it a visual trial, and that's a real simulation in your mouth of what the teeth could look like. We can then shape that until we have the final result that you like. We can also now mill 3D veneers, plastic temporary veneers, that we can also put on your teeth. So it's entirely possible before touching your teeth to show you exactly what your new smile can look like.